Assalamu alaikum dear doctors. In this video I am discussing about spinal muscular atrophy and myasthenia gravis, and this paragraph I have taken from RCPCH Theory and Science book, case number 32. Let's start. First, spinal muscular atrophy. Spinal muscular atrophy or SMA is an autosomal recessive disease, and the gene codes for an important protein called SMN1, which is involved in motor neuron survival. SMA causes progressive degeneration of the alpha motor neuron from anterior horn cells in the spinal cord. Progressive lower motor neuron weakness occurs in all muscles. Most notable, the proximal muscles rather than the distal. If Jaffock had spinal muscular atrophy, he would have a more global weakness, hypotonia, with very reduced or absent reflexes in his extremities. We might also see tongue fasciculation. The diagnostic test of spinal muscular atrophy would be genetic. Returning to the questions, toe walking would not be a recognized feature of a LMN lower motor neuron lesion, and Jacob's good muscle bulk and normal ankle reflexes are against him having a significant lower motor neuron problem. Electromyography is the unlikely to be a help in the diagnosis, and we would not expect to find tongue fasciculation or decreased anal sphincter tone on examination. So, from spinal muscular atrophy, these topics we know that it is an autosomal recessive condition. Remember, SMA is an autosomal recessive conditions, and due to protein called SMN1 gene, that gene codes, and its pathophysiology is progressive degeneration of the alpha motor neuron of anterior horn cells of spinal cord. This question come on the exam, SMA pathophysiology, and that is degeneration of the anterior horn cell of the spinal cord alpha motor neuron. And the clinical feature important is that tongue fasciculation present, severe hypotonia, global weakness, very reduced or absent reflexes, these are present. And SMA diagnostic test is genetic. Remember, SMA diagnostic test is genetic. Now about myasthenia gravis. Muscular disorders include problem at the neuromuscular junction, that is myasthenia gravis, and those of the muscle fibers themselves, muscular dystrophy. Myasthenia gravis is an autoimmune disorder where antibodies are directed against acetylcholine, nicotinic polysynaptic receptors. So this question come on the exam, myasthenia gravis pathophysiology or cause, that is myasthenia gravis is an autoimmune disorder where antibodies are directed against acetylcholine, nicotinic postsynaptic receptor at the neuromuscular junction. This leads to a reduced number of receptors available to be activated by release of acetylcholine from the presynaptic lower motor neuron. The classic symptoms are of fatigue weakness with successive lower motor neuron impulses generating over weaker muscle contractions. The presenting symptoms are commonly of eyelid weakness and decreased facial expression, bulbar symptoms, speech and swallowing problem, and of muscle weakness, proximal more than distal, upper limb more commonly than lower limb. Fortunately, heart and smooth muscle have different structure, acetylcholine receptors, and are not affected. The typical pattern is with weakness getting worse throughout an activity and recovering with rest. Many patients find the weakness worse if they are hot and better. If they are cooled, for example, having a cold shower, physical exam may show ptosis and rapid fatigability. Tendon reflexes and plantars would be normal, and you would not expect the child to be walking on their toes as it is described in the vignette. Diagnosis of myasthenia gravis can be aided by antibody testing, electromyography, or administration of the anticholinergic adrophenium, and assessing the improvement in muscle strength caused by the result increase in acetylcholine at the neuromuscular junction. The test is tensilon test. So from myasthenia gravis, what we know that myasthenia gravis, the pathophysiology is that autoimmune disorder where antibodies are directed against acetylcholine nicotinic postsynaptic receptors, and the clinical features are that mainly eye involvement, eyelid weakness, decreased facial expressions, bulbar symptoms like speech and swallowing problems, and muscle weakness, proximal more than distal, upper limb more common than lower. But fortunately, heart and smooth muscle are not affected. And we can test, that is tensilon test is for diagnosing myasthenia gravis, one thing, and that administration of electromyography or administration of the anticholinergic adrophonium. Remember, anticholinesterase adrophonium, and assessing the improvement in muscle strength. And myasthenia gravis actually present with like ptosis, facial muscle weakness, eye, mainly eye affected, eye weakness. That is the main feature of myasthenia gravis. Please do subscribe and share my channel, everyone. Thank you.